Okay, so this is Shilpa here, and we are answering questions on miasms, posted by my students from my Argentum mentoring program. And this is a question by Helena. She said, what does it mean when you say children that have latent syphilitic or cancer miasm, for example, can be cured before it gets expressed if we start them with homeopathy early? What about miasms and generational trauma? Can we work on that through homeopathy too? How would you communicate all of this to our clients? So I like this question because it gives me an opportunity to define what is latent and other related miasmatic expressions and their definitions. Now remember, these are terms in Kenton miasms, and that's why they have great practical value. If you don't know what are Kenton miasms, I would take you back to my video on miasmatic definitions and Kenton miasms. But you have to understand that when a miasmatic agent triggers an infection, that primary infection doesn't stay acute and primary. It goes and internalizes to create a secondary miasmatic disease. And this impact of that primary infective agent is going to, percolate deeper and deeper to create a layer or a miasmatic state. And while it's doing that, it goes through a number of different stages, which is based on my stages concept. So let's start with, stage 4, right? Stage 4 is at a level where if there is a past history or a family history of some form of acute primary miasmatic phenomena, it could be an infection, it could be a trigger, but some form of a fundamental trigger, it goes through its course. If it's let alone, untreated, it will internalize to create the latent miasm. So it could be any known miasmatic triggering fundamental causative factor goes down and internalizes inside the patient to create the latent miasm. If it's inherited, then you can see the latent miasmatic indications right since birth. It is traced to the state of the mother in prenatal life, or father during conception, or the family history, where you can see some form of generational trauma for confirmation. But you have to remember, this latent miasm can remain dormant for years. The only way is through tracing the past history, looking at the prenatal history, looking at the family history, or you can look for certain specific predispositions, innate constitutional traits, some form of genetic physiological makeup, highly peculiar mind-body sensitivities, some idiosyncrasies, some specific physiognomical body structural changes, genetic phenotype or physical mental makeup, pathological predispositions, and so on. This is what I call stage 4, which is where it is still at a very latent, at a very start. Nothing has actually happened. The person is seemingly healthy, right? So this is the definition of latent miasm. Hahnemann has given a beautiful understanding of latent sora in his book Chronic Miasms, Chronic Diseases, and Kent has given you, constitutional symptoms related to will and morals and love and hate and desires and aversions and intellect. All these traits are, traits of latent miasm. And Vijaykar has also given you a lot of innate genetic constitutional factors based on the structure of the body, your height, your shape, your teeth, your hair, features, the contours you have, your color of your hair, nails, skin, the non-disease nature, like, the traits and tendencies to be angry or courageous, or some sort of constitutional personality traits, like being contented or fastidious or diligent or conscientious, whether you're hot or chilly, you're thirsty or thirstless. This is not disease. This is predisposition or inherent miasmatic traits. physical tolerance to sun, to wind, to moon, mental tolerances to grief, fear, all these predetermines the nature, the pace, the depth, and the kind of damage at a functional or structural level at later stages. All these are the latent miasmatic traits. Sankaran talks about distorted beliefs to everyday situations based on his basic delusion, the way you cope and way you react to everyday situations. This is all miasmatic understanding at stage 4 and some of them at stage 3. And the person can remain in this stage for a very long time in a seemingly healthy phase without major problems and can function okay day to day. They would say, I have no problems. It's only with the detailed homeopathic history that you get all this information, right? Now, this is what I call latent. It is under the surface. It is nothing is seen. Now, if there is some form of exciting cause, then this latent will arouse itself and become active. What are those factors? Now, Hahnemann has identified 6 main exciting factors, right? Some of them are, suppression with conventional drugs, or an acute situation, an acute condition, some sort of a shock or trauma, some form of changes in diet, or, some sort of starvation or hunger or advancing age or loss of loved people, any form of dramatic change in the environment which could leave that person unhappy or in grief or embittered or for a long time can actually excite this dormant and latent miasm. And this, when aroused, awakened, it creates an actual disease that's finally expressed through functional signs and symptoms, starting at the mind and the body, through physical generals, mental generals, and then this secondary active sora will move to the locals and the particulars. So can you see it goes now from stage 2 to 1. At stage 2, it is now focusing and localizing in different organs and systems to give rise to local particular symptoms. And this is also based on the predisposition and the weak spots in the patient. And then it will give rise to local pathology and organ damage in deeper and more vital organs, which is the tertiary active miasm. So that's how it goes from latent to active. And so when we use the word latent, it is the miasm which is not yet aroused. And when we say active, that is actual chronic conditions. This is the time when the patient actually comes to a homeopath. Because before that, most people think they are okay, they're healthy. So coming to your question now, what does it mean for children that have latent syphilis or latent cancer miasm? Can they be cured? It's a very interesting word before it gets expressed if we start homeopathy early. So a latent syphilis miasm will show indications of latent syphilis in its innate stage, in its predisposition, in its constitutional traits. Or you could also see these traits in the family history, tendencies to, ulcerated sore throats or soft palate or bone necrosis or periostitis or insanity or alcoholism or suppuration. Some principal sites of damage in the vital organs like brain and liver and kidney and spleen and heart and, lungs, all sorts of deformities and malformations and teeth in the bones and the teeth. Mentally, there could be dullness and heaviness and stupidity and stubbornness and suspicion, depression, suicidal tendencies. They could be really worse at night or restless, driving them out of bed, or they could be very unsocial or even tendencies to criminal activities. So everything is out of control with perversions in their mind and body and their speech. And everything is out of control with violence and destruction and aggression. So this is what you see in latent syphilis as it starts to be activated. But these are all tendencies in their past life or in the family history. There is no actual disease as such, right? You could see actual diseases in the family history, but they might not yet be in the patient. So your past history, your family history will actually give you a lot of information about latent syphilis as well. Now in cancer miasms, the latent cancer miasm, Fubister has described it beautifully. He speaks about blue sclerotics and coffee-colored complexion and numerous moles and insomnia and tendencies to inflammation, severe inflammations, whooping cough and pneumonia very, very early in life. Or the child is sleeping in knee-elbow position or has some sort of prolonged fear, unhappiness, fastidiousness in very early responsibility in little children, enjoying watching thunderstorms, or a very good sense of rhythm at a very early age, dancing and sensitivity to music and sympathy and empathy and taking on the pain of others and being very sensitive to reprimands and wars being in sea air and all these things, they are, latent cancer states. And the best part is, if you can find a good remedy based on this latent state, which we call a constitutional remedy at stage 4, which covers these traits, you can actually reverse and get these children to develop normally and become more happy and content in life. We can switch off the genes that have been turned on due to the environmental conditions, the prenatal or the generational trauma, by nipping in the bud and remaining the latent state will remain for a very long time. You can prevent it from becoming active. So you cannot cure in that way because it will still remain in the latent state, but at least the patient is able to cope with life much better, and they are going to be able to withstand the stress, and they're going to be seemingly in that state of being able to resist in stress and lead a more or so normal life in that state. So they don't go on to become full-blown secondary miasmatic state, diseases at stage 2 and 1 and develop that pathology. You can keep them at stage 4 with the so-called constitutional genetic anti-miasmatic remedy. You cannot change genes, genetic diseases, but you can prevent or reverse the epigenetic diseases if given early enough, given to prevent these future acquired secondary miasmatic states. You can neutralize these factors and these gene expressions because it's a chemical change. So all these conditions can remain in latent state. You can temper it down, keep him in a seemingly good state of health, cope well in life so he can bounce back with those exciting factors. So they do not have to take him downhill into the secondary and tertiary miasmatic states and develop disease pathology. And this is perfect for most chronic autoimmune neurodegenerative or neurodevelopmental conditions that have multiple causations, including genetic and epigenetic factors. So hope that helps explain your patients as well what's the scope of homeopathy and what can we do and what we cannot do.